all know the holidays are a wonderful time, but they can also be a really challenging time for many, and that includes kids. So here to help us check in on the mental health of the young people in our lives is Dr. Josephine Young, a medical director at Premera Blue Cross. Welcome back. Thank you for making this a priority.
Oh, absolutely. This is so important.
It really is, because there are so many new reports that are coming out right now that show young people are struggling more than ever with mental health. So what are some things adults can do to support these kids?
Yeah, I think a lot of it is just being aware. I think if you see kids, whether your own kids or kids in your life, just see kind of how they're doing. Do they feel different than they normally have been?
Yeah.
Are they a little bit more withdrawn? Or maybe are they acting out more? Just something feels off. Maybe just check in with them and say, hey, how you doing? And pause. Give them time to actually answer that question.
Yeah.
Because the first answer, fine.
Yeah.
Okay. How are things going with your friends? How, what are you looking forward to? What's up?
Yeah.
So just engage them in a conversation and connect, because I think a lot of times, especially through the pandemic, it's been such an isolating time, and they've had to really figure out, like, where do they fit into the world now? And so just stay connected and see where they're at.
That's such good advice, is just to ask, and we forget sometimes. Instead of like, what is going on with you? Versus, no, what's going on with you?
Yeah.
So important. Are there other signs to look for? You mentioned, being withdrawn or acting out that might indicate a kid is struggling with their mental health?
Yeah, definitely. Other things that, typically, are they sleeping a lot more than usual? Are they sleeping a lot less than usual? Are there people wandering your house in the middle of the night and then sleeping through the day? Like, things are just kind of turned upside down in a way.
Yeah.
Are they eating a lot more than usual? Are they eating a lot less than usual?
Okay.
Again, all of those normal day-to-day things, but they just feel like they're off their norm. Something is different. And I think one thing to keep in mind too, as an adult, to not run around and try to diagnose anything, because there's always that temptation, or let me go look it up on the internet, like what is going on with them.
Oh, yeah.
No, just get a sense of, if something is off, then talk to the professionals who are involved.
Yeah.
Check in with their doctor, have an appointment, things like that.
So, and it's important to trust your gut. I know for many of us, this is, going through my first child getting older, sometimes I'm like, is something up, or should I trust my gut? How important is that for parents to trust their gut?
Oh, absolutely. That parental radar is amazing. And the thing is, you don't even have to know exactly what's wrong. Your job really as a parent is to understand when something has changed. And it's figuring out what has changed, and then we can then figure out what is causing that change.
Yeah. You mentioned professional help, but sometimes it can take weeks or even months to get in an appointment when we desperately need clinicians that can treat kids and adults. We've got a shortage. So are there other ways parents can help their child get care?
Yeah, one of the things to do is actually call the office, not necessarily for an appointment, but call the office and talk with a nurse.
Okay.
And say, this is what I'm concerned about.
Okay.
And the nurse can help you figure out, hey, yes, let's work on getting you in sooner.
Okay.
Or no, this actually is okay. Here's some things you can do.
Yeah.
And then in the meantime, and then maybe come in later, or maybe you don't need to come in at all.
Right.
And you just needed some reassurance. And whether you're talking to the nurses at your own doctor's office, whether you're talking to, for an insurance company, there's also like nurse line support, things like that. Through different employers, there are all sorts of virtual care options. there's a lot where you can get care like immediately.
Yeah. I've been on the phone with Premera before, asking for, and they can email it to you, but the woman literally stayed on the phone with me and went through each person near me.
Yes.
Because I was having a connectivity issue, and they stayed on I was actually really touched by that. It meant a lot to me that they were able to do that.
Absolutely.
Here's another question, because even with all this conversation around mental health, I talk about it here very freely, but I know there is still a lot of stigma.
There is.
Especially when you're a kid and you're embarrassed about everything as it is, like your mom singing in the car in front of her friends. But when it comes to asking for help and seeking care, how can adults shift that thinking both in themselves and in their kids?
Yeah, I think a lot of it, the first step is really thinking about mental health care, the same as physical health care. When we sort of split those up, it's so arbitrary. We're one person, one body, one set of experiences, and we're trying to say, well, mental health is something different. No, it's not. And when you think about well, you know, if you're feeling down about something, your appetite's off, you know, your sleep is off. I mean, all of these things are very connected. And so I think just helping kids understand the connection that's there.
Yeah.
And sometimes if they're walking and saying, oh, my stomach really hurts, and you go through the usual things, are they sick, did they eat something strange, all that. And it's like, you know, sometimes if you're feeling a little stressed, if there's things going on that are bothering you, these things are connected. And so in the same way, like, these are all things we can talk with a doctor about, because this is part of just normal existence of being, and normalizing some of that can help.
Walking them through that. I never even thought to do that, and kind of identifying what might be making their tummy hurt, and then but helping them understand that it could be that.
Right.
Josephine, I learned so much every time you're here. Thank you so much for coming. Thank you for talking about this. Absolutely. And if you would like to learn more about what we discussed today, just visit the website on your screen, premera.com/mental health.
This portion of New Day Northwest is sponsored by Premera Blue Cross.